and welcome to this edition of InnerView. I'm Melissa Sebring. On today's show, we're going to discuss seasonal depression with Margaret Keeler, the president of the National Alliance on Mental Illness, and Lily Yen, an assistant professor of psychology at Michigan State University. But before we go into the interview, let's learn a little bit more about the topic. The winter blues could be more than just a little cabin fever.
My stepmom used to have it, and we dealt with it growing up in our childhood.
Alejandro's stepmom moved to Michigan from Guadalajara, Mexico, and began experiencing seasonal affective disorder.
As she got diagnosed with it, she started having panic attacks and massive depression.
Alejandro describes what it was like growing up and watching the depression slowly get worse.
Terrifying. There was an incident where she had a pretty bad panic attack, and she said that she felt like she was dying. Pretty scary to see as a kid.
Having seasonal affective disorder means having major depressive disorder with a seasonal cycle.
They have a space of time where they're experiencing the depression either during the winter or the summer.
Michael Whitehead said the theory behind the disorder occurs in the winter when there's less sunlight exposure. It can alter sleep patterns or suppress melatonin and serotonin.
We treat just like typical depression, but we add on the extra treatments of like a light box, or if it gets too severe, we also add medication.
Seasonal affective disorder can be just as severe as any depression, and it requires treatment.
Eventually it came back. A lot of anxiety, a lot of panic.
Michael said it's important to check yourself by monitoring mood changes or losing interest in some of your favorite things for longer than 2 months. Now that we know a little bit more about the topic, let's officially introduce our guests. First, we have Lily Yen, who is an assistant professor in psychology department at MSU, and we also have Margaret Keeler, the president of the National Alliance on Mental Illness. Do you want to just tell me a little bit about what you do?
Well, I work in psychology department at MSU, and one of my research interests is to understand what's going on in our brain during seasonal depression, like what's the neural mechanism underlying that.
Very cool. And you, Margaret?
And yes, I am the current president of the local affiliate of the National Alliance on Mental Illness, which is the largest grassroots organization that's dedicated to families and individuals who are dealing with mental illness. And so we are the local affiliate of that. So.
And how common do you guys think seasonal depression is? Or do some people take it to a more extreme of just, I really don't like winter, or how severe can it be?
So I think at the population level, it affects about 2 to 3%. But when you move to, say, up north, you will see the number going up. And I think in Michigan, I mean, even you compare cities about the same latitude, Michigan probably worse than other areas because the lake effect, we just have more cloudy days, and plus a mild form like winter blues, it may affect up to 20% of students, population. And actually I once did a survey in my class just to ask the undergraduates in the class to see what's their seasonal pattern and how many of them actually experience this kind of symptom, and the number I got is 20 to 30%.
Wow. Wow, that's amazing. And what about for you? Because you deal with mental illness. Do you see a lot of it? Is it common?
Well, I think that there is some degree of controversy of is this an underlying primary illness of a depression that's going on? And when you look on the National Alliance on Mental Illness website, they do reference that there is that controversy, but that there is those seasonal cycles, and depression, if you look at that illness, is one of the most common of the psychiatric illnesses. So it's quite common, actually.
Yeah, and so since seasonal depression usually does mean that you have major depressive disorder, do you see that often, that people that have major depressive, they do experience the seasonal cycle?
Well, I think that within that particular diagnosis of seasonal affective, as was already brought up, is the changes in how serotonin, or the neurotransmitter, is processed during the times when the light's not so great. And I know Dr. Yan probably has a lot more detail about that. But I think the major thing is that there are those effects, and it's really important that families, actually, or individuals become very educated about what is going on with them, that they seek help and treatment, because otherwise they may not be functioning at a level that is optimal. And
yeah, and so what do you think the major difference is between the seriousness of seasonal depression with other types of depression?
So for seasonal depression, it is a major depressive disorder. I think you mentioned that at opening. Just a major depressive disorder with a seasonal pattern. So the severeness is pretty much the same as other types of major depressive disorder.
And then do you think because I know you mentioned it's with the light, so is the cold temperature not as much to do with it as it is the light, or is it a correlation between the two?
Well, I think just based on the science literature, it has more to do with light than cold temperature. Yeah. So it's more caused by light deficiency in winter.
And do people normally, they acquire it over their lifetime, so is it from a drastic move? If you're, like in my package that we showed, his stepmom moved from Guadalajara, Mexico, so that was a major life change for her. Is that normally when it starts to develop?
I think it's going to be variable. Certainly when people are, there's the added factor that when our skin is not exposed to sunlight and UVB and A rays, then we are not, in the northern latitudes, I think we also see a lot of vitamin D deficiencies, which is another layer of problem. I don't know if that's something that you notice, but I am do work in a clinical practice, and when I do check for vitamin D levels, there's quite a few people that are deficient in vitamin D. So that, and we know that vitamin D production occurs in the skin. That's our factory for vitamin D. So that's just another factor. But but that's not really the same as the issue of light. Is that correct? Of exposure to light in terms of vitamin D production.
Yeah, that's different from how light affects the brain, the neurotransmitter, as you mentioned earlier.
Okay.
So how do you check for someone's vitamin D levels? Is that, I'm not familiar with that. Is it something you check in their blood, or how does that work? So
in a clinical practice, when somebody comes in with a diagnosis of or symptoms of depression, everybody is entitled to a good medical exam, and that is really what NAMI will always say right up front. It's important that you see your primary care provider and get a good medical exam, and that includes testing for vitamin D levels, and along with things like thyroid and your complete blood count, and maybe even looking at things like mononucleosis, things like that. So there's a battery of tests that somebody may receive when they have a medical evaluation. So then you look at that and make decisions based on that. And a lot of times it's vitamin D supplementation if the vitamin D is low.
Oh, okay, that's very interesting. And in your guys' profession, what do you think are some of the better ways to treat seasonal affective disorder or seasonal depression?
I think at the beginning, the doctor mentioned the light therapy is the most common treatment for seasonal depression. And yeah, on top of that, I think even with bright light therapy, it can help about 50% of the patients. There's still people do not respond well to bright light therapy. And for those patients, I think the options are like antidepressant drugs or other, say, talk therapy, like whatever used for other type of major depressive disorder, and they can be used for seasonal depression as well. But the first choice would be bright light therapy.
Do you also agree that you find that to be the more common treatment?
And and again, NAMI always recommends with any of the major mental illnesses or depressions, is that, you know, we're trying to stimulate our bodies to function at a higher level. So, you know, one of the other simple therapies that anybody can engage in is exercise and improving diet, because one of the symptoms of seasonal affective disorder or seasonal depression is a craving of carbohydrates. Sometimes that's happened. I don't know if that's something you notice in your research, but that the higher carbohydrates, and I think that as we all know, once you get into some of the higher carbohydrate diet, it can, you know, have an adverse effect on how you feel as well.
Does it lead to any other health problems, seasonal, like with the carbs, that has to lead to some things as well? Or what do you guys feel about that?
So I think I read something actually special about seasonal depression. Is there some atypical symptoms in seasonal depression? For example, patients suffer from seasonal depression, they tend to sleep more instead of sleep less. And carbohydrate creation is another atypical symptom. And one of the idea is in carbohydrates, it's rich a precursor of serotonin. That's what our body or our brain needs to improve mood. Like one of the major antidepressant is to increase serotonin level in our brain. And by having more carbohydrate, that may help increase serotonin level in the brain. So that's some extra benefit. But it's like we cannot, there are individual difference, of course. So that's just one type of study suggests that. So I'm not sure would that apply to everyone. So there are individual difference, so everyone should watch their diet to make sure what helps them.
Yeah.
That's very helpful. That's true. So you're saying that it's like the body's trying to respond to and attempt to increase serotonin, and therefore you compensate by increasing your carbohydrates.
Yeah, that's one of the ideas
Uh-huh.
up there.
It's really good to have a researcher here who looks at all of this stuff.
And so I've also heard rumors, they didn't prove true in some of my research, about tanning beds, because I've heard some people say that it helps with seasonal depression, but I don't know if the science is behind it. Are you guys familiar at all with tanning bed therapy?
Go ahead.
Oh, I think there are reports, like individual report after tanning bed treatment, they feel better, improve in their mood. But personally, I don't see much science behind that. I think for us to receive the benefit of light or bright light therapy, or just even the bright sunlight outside, it's the photoreceptor in our retina responds to it and carry those information to our brain, and to promote all the changes, like improve the level of neurotransmitter by resetting of our body clock. So for all those kind of benefits, we need light reach to our eye, our photoreceptors, basically.
Yeah, so with tanning, it makes it tough because your eyes are either closed or you're wearing goggles, so it must just be the comfort of the warmth or something like that.
Well, I think that it might be also, there is some benefit to the of the UVB in terms of the production of vitamin D. And so while they both help, light therapy will help with mood, vitamin D also helps with mood, but they're not it's different. The light therapy is actually doing something different, is what you're saying. It's going to the photoreceptors and stimulating the neurotransmitters in your body, versus in the tanning bed you may have some of the secondary benefit of increasing vitamin D production because of the light, the UVB lights hitting your skin. Especially in tanning issues, though, you also have to look at what is the risk-benefit ratio, and is there truly a risk of, say, skin cancer when you do that type of stuff excessively, and that's an important thing to look at as well. Not that I want the tanning industry to be upset, but I think that it's always important whenever you do those things to do them carefully and know why you're doing it. So.
Do you think it's common for doctors to suggest tanning to people, or do you think it's more about the light boxes?
Well, I just would say that, as with any, number one, it's very important to have a good understanding of what is happening with that individual, so that they have a proper history and physical and a proper diagnosis, because you don't want to just say, oh, just go out and do that. You want to know that you're determining whether this is major depression and with the seasonal impact on top of it as well, and whether so it's really important to have a proper diagnosis. And I don't think that any good provider is just going to say, oh, well, if you're not feeling good, just go out and do a light therapy. That's not. That you would want to have all those assessment and diagnosis in the proper format. So
what are some of the dangers, like down the road, if seasonal depression isn't treated?
Go ahead.
So without treatment, first of all, without treatment, when the season change, like in spring, all the symptoms would disappear. And the patients just feel normal, and some of them even feel hyper. Some people describe that as similar as bipolar, so they even feel some mania-like episodes in summer season. But if the severe depression was left without any treatment, it can lead to, so first of all, it's impact quality of life, right? And affect relationship. Like, one of the changes in seasonal depression is the individuals don't feel like to engage in any social activity, so that could affect many things. And in the more severe case, like, it could lead to suicide. So that's definitely for any kind of major depression treatment, seeking professional help is essential.
Would you recommend continuing the help throughout the year, even in the seasons where the depression isn't as dominant, I guess you could say?
Well, I mean, there are, if you can, if you have the proper diagnosis and somebody can see that, oh yeah, I start to improve at this time of the year, just as Dr. Yen said, that, maybe you can start with the guidance of your therapist or your physician or your provider, that you can start cutting back on that light treatment. But there are times, according to National Alliance on Mental Illness, in their literature, they do talk about using prophylaxis throughout the year. In other words, continuing therapy like antidepressant therapy, if that is the chosen treatment throughout the year, so that a person doesn't drop back into the depression when the season changes again.
And we didn't really touch on, but it is also in the summer, people do experience the opposite. So I know, because the light therapy is used in the winter because of cloud coverage, what is recommended for when seasonal depression is experienced in the summer when there's too much light?
I guess summer depression is a totally different story, and I think what caused that summer depression, it's not well understood comparing to winter depression. And one of the issue could relate to, as you mentioned, it's more sunlight, or it could be just hot weather, the temperature. I think it will depend on the cause of the problem to determine what's the best way to deal with it.
Do you see it very often as someone experiencing the depression in the summer?
Well, and I think that when you look at the universe of mental illnesses, there's going to be variability, seasonal variability, but it's important, again, to have the proper diagnosis, because if somebody has, say, a bipolar depression or also known as manic depression, and their symptoms change in the summertime with the light, then that is something that's very important to look at. So, I don't know all the statistics about when there's higher rates of suicide or suicidality or worsening of symptoms in each of the different depression and mental illness diagnoses, but there is variability, and as Dr. Yan said, that it's a little bit tougher to sort that out, because it might be mixed in with all these other types of symptoms that overlap.
Is there a tie to genetics at all? I know with a lot of other mental illnesses, it can be linked back to that. Is seasonal depression another one of those things that could be down the family line?
I think genetic factor definitely can contribute to this condition. And actually, one of the leading hypotheses for seasonal affective disorder, seasonal depression, is that during winter season, there's less sunlight, and that causes the body clock, it's also called circadian rhythms, out of sync. And when we look at the population level to look at genes, what genes are affected, so one of the genes get affected could be like clock genes contributing to circadian rhythms. And the other genes have been reported so far had association with seasonal depression. It's one of the serotonin receptor gene, and also the genes encoding the photoreceptor in the retina. So all these pathways, the gene involved in this pathway from light to the retina to brain clock down to neurotransmitters could have something to do with seasonal depression. Yeah.
And go ahead.
I just was going to say that it looks like some of the, if you do a family history or health history, that some of those individuals do have other mental illnesses in their family and some substance abuse as well. So those are some of the things that can be looked at. There is a correlation with that.
Well, we only have just a few minutes left, so I'm just going to introduce you guys one more time. We have Lily Yen, an assistant professor of psychology at MSU, and also Margaret Keeler, president of the National Alliance on Mental Illness. Do you guys have anything else you wanted to add about the topic or anything like that?
Well, I think one last thing is if light therapy is prescribed, it should be done with the guidance of a provider, a mental health provider, and many of those lights are not covered by insurance, but they cost out of pocket somewhere between $60 and $250 is what my research showed. So, and it's important to do and initiate anything like that with the guidance of your mental health or medical provider.
Well, thank you guys so much for coming out tonight. That's all the time we have for this edition of InnerView. You can follow us on Facebook or Twitter at HOMTV or use the hashtag InnerView. For HOMTV, I'm Melissa Sebring. Thank you for joining us.